Hey guys, myself Salvina. Welcome to Nursing Guru. Today I already came with another topic which is psychiatric disorder. So I am going to tell about what is GAD. GAD's full form is Generalized Anxiety Disorder. It is a type of disorder, psychiatric disorder, in which the GAD is a common chronic disorder characterized by the long-lasting, non-specific anxiety that is not forced on any one object or situation. It's called GAD or Generalized Anxiety Disorder. So now I'm moving to another topic. It's coming the Panic Anxiety Disorder. In Panic Anxiety Disorder, it is also most common psychiatric disorder. In this disorder, like panic anxiety refers to the sudden and the repeated panic attack and person's expectation severe psychiatric symptoms such as a chest pain, heart palpitations, that's all. So before I already told about the anxiety disorder, in anxiety disorder so many condition is there. In another one I am going to another one condition which is that is the phobic anxiety disorder. In phobic anxiety disorder, the phobic is a differentiation as and the irrational fear of the specific object, situation or activity. So in optional, the often leading to the persistence and avoidance of the fear about situation or activity. So it's called the phobic anxiety disorder. So in phobic anxiety disorder, three type is there. In this three type, first will come the social phobic, specific phobic and agoraphobic. So guys, I came with another topic which is under the psychiatric disorder. It is the most common disorder, OCD. What is that? Is it a disorder is characterized by the undesirable respective obsessions and compulsion. So in OCD, people having the clinical features. What is that? In OCD, two clinical features is there, like obsessional thought and compulsion behavior and tearing the paper, continuously talking like this, that OCD will come, like example will come. Understand? So autism. What is that? In autism, it is a disorder of the neural developmental characterized by the impaired social interactions and communications with others. It's called the autism. So people cannot adjust with another people, don't talk with another people. In autism, like this type of symptoms will come. So guys, now I am going to tell about the somatoform disorder. In somatoform disorder, people having the group of disorder that causes the unexplained physical symptoms that human being having the discuss, and this is the central features of the symptom disorder. So now I am moving to the bulimia nervosa, another one psychiatric disorder. In bulimia nervosa, it is characterized by the frequent episode of the benign eating followed by the behavior that compensate for the overeating, such as a forced vomiting. People will vomit forcefully, having more and vomit forcefully. It's called the bulimia nervosa. So it is a common disorder in psychiatric. So my last topic is like personality disorder. It is the most common disorder in psychiatric. So we were going to know what is that. In personality disorder, people having when the personality become the inflexible and the maladaptive with the another people. Okay, it's significant with another people. That is called the personality disorder. So I am going to tell again. The personality disorders occurs when and the maladaptive behavior or inflexible behavior is coming significant, the functional impairment and subjective disorder. It's called the personality disorder. So guys, I completed my all topics regarding psychiatric disorder. Guys, if you have any doubt about psychiatric disorder, please comment in comment sections and subscribe, like and share our channel. Thank you.